Hello, my name is Paul Nystrom. I'm one of the emergency medicine physicians at HCMC, and I also do EMS medical direction. I'm also a part-time police officer with the city of Plymouth. So today we're going to be talking about eating better. And this is what I hope will turn into a four-part wellness series over the next few years. The main 4 parts of wellness really include eating better, prioritizing sleep, smarter exercise, and having community. And those really are the big main tenets of long-term health. So we'll get right into it. A couple of disclaimers. The ideas and opinions here are mine. They don't represent anybody else's opinions, specifically anybody that gives me a paycheck. I do mention lots of specific names and brands because I believe they have value. I also have a lot of biases, but I don't have anything to sell. I don't have a newsletter. I don't have a website. I don't have anything to sign up for later. So I really literally steal a bunch of information from other folks that I then try to compress into a good message and what I think is a good message about wellness. So at the end of the presentation, there'll be a slide that has all of the people that I read, the books that I recommend, folks to follow on social media, websites to check out. And I can also make sure that you get a copy of this on PDF to have access to those things as well, which also has my contact information if you have any questions about any of this. So some of you may have heard me already because I have spoken to the sergeant class, FTO class, cadet classes a few times in 2018. So you might notice there's some repetition, but you also notice that I continually add things to this talk and try to update it and make it a better message. One of the obvious reasons why we're talking about wellness is that heart attacks are a big deal. So if you go to the Officer Down Memorial page, there were 17 heart attack deaths in 2018, and I'm recording this right at the end of the year here in 2018. That next line I think is very telling though. The ages of the officers are 25 to 58. So that's kind of a big deal. This isn't like 70 and 80-year-old guys having heart attacks. It's young people having heart attacks. And heart attacks actually ranks 3rd for deaths every year on the Officer Down Memorial page. It's consistently 3rd after GSWs and MVCs. As far as the actual agenda today, we're going to briefly highlight the metabolic health problem that we face, sort of obviously as evidenced by heart attacks. That's one of the big ones. And then we're going to talk about our history of eating, specifically our fear of fat and how we got to that point. We're going to talk about insulin as the root cause of chronic health issues that we see nowadays. We're going to talk about some better options and some practical strategies. And my hope is that I'll encourage you to explore this more on your own and read some of the things that I recommend, or take a look at websites, look at some books, think about making some changes to how you eat. But I also realize that we have 90 minutes. I've been tweaking the way I exercise, the way I eat for like the last 10 years. I was in the Navy 10 years ago out in California in 2008. I was stationed with the Navy SEALs. To be clear, I'm not a Navy SEAL, although that came up recently. I'm not in that class, and I don't want to be in the class of people that lied about being a Navy SEAL. So let's be clear, I'm not a Navy SEAL. I was stationed with those guys, though, and that was the time that I started tweaking things. And so I've been tweaking things about my health for about the last 10 years. So what that means is that I realize that when you leave, after you see this talk, you're not suddenly going to completely change your mind 180 on things that you've long held as the way you do things. Right? It doesn't work that way, but I hope that in 90 minutes I can convince you to at least think about some things differently and maybe consider tweaking some things that you do with your health. It's important to know that what I'm talking about today is that one size does not fit all. Essentially, everything you do is on a curve. So, for example, on one end of this curve, you have people who smoke every day, 3 packs a day, and they don't get cancer. On the other end of the curve, you have people who never smoke at all, and they still get lung cancer. So somewhere, just about everything you do falls on one end, one side of that curve or the other. It's not the same for everybody. And the same thing applies to how you eat, how you exercise, how much you sleep. It's not the same for everybody. Looking at another way, we can think about it as intolerances. So if there's things that you don't tolerate. So if you're lactose intolerant, nobody's going to tell you like, hey, you should have more lactose. Because, right, you don't tolerate lactose. It tears up your guts. Anybody who has that is not going to be able to be convinced that you should have more lactose. It doesn't make sense. Same way if you've been diagnosed with a gluten allergy or gluten sensitivity, or if you just tried that on your own and you've cut out gluten from your diet, you feel great. It's pretty stupid for somebody to argue that, yay, you should have gluten. You need to have a balanced diet. Make sure you have some gluten. It's like, no, I don't tolerate gluten. That's not worth it. The same thing could be said for alcoholics. If you're an alcoholic, telling you to count how many drinks you have which is sort of like what we do with our diabetics and telling them to count carbs. That doesn't make any sense. If you're an alcoholic, you've proven that you can't tolerate alcohol. It's the same with any sort of food allergy. If you're allergic to peanuts, you shouldn't have peanuts. That's pretty well understood. Looking at this picture, and as it relates to health, there's people who drink enough soda that they're raising stock and Coke all by themselves. They don't ever get sick, don't ever have metabolic problems, don't gain weight. There's people on the other side of the curve who look at cake and they gain weight, right? So depending on where you're on that curve, it sort of determines how you have to adjust what you're eating. Looking at carbohydrates specifically, and yeah, I'm letting the cat out of the bag early here. My takeaway, if you fall asleep right now, eat less sugar. Okay, if you don't remember anything else from today, eat less sugar. But in terms of carbohydrate tolerance or intolerance, these metabolic diseases, sometimes referred to as Western diseases, and what that means is that anytime you take a population and introduce sugar, and to a lesser extent flour, it's mainly sugar, you get more chronic diseases like these. You also get more asthma, more gout, more gallbladder disease, arthritis. The list goes on of diseases that come with eating more sugar. So, and essentially all these diseases are primarily carbohydrate intolerance. Like type 2 diabetes could actually be called carbohydrate intolerance. So hypertension caused by the same mechanism, heart disease, the same thing, and a little bit later we'll get into why that is or why I think that's the case. But they're all the same. And it doesn't matter if it's fair or not. So if you have these metabolic diseases or other similar metabolic diseases, you've proven that whatever level of carbohydrates you're having, you don't tolerate. Right? So you need to have less. So, and again, it doesn't matter if it's fair. It doesn't matter if your buddy can eat way more than you, your spouse can eat way more than you. If you have these chronic conditions, what's driving them is carbohydrates. So you need to have less. That's the bottom line. All right, so let's start to dig back into the history a little bit about this. So this book, this is a summary of 10 points from a book called Good Calories, Bad Calories by Gary Taubes. It was written in 2007. We're going to talk about these main things that you see listed on the side there, the saturated fat issue, the insulin hormone, and calories. For the sake of time, we won't be able to get into the weeds on the calories piece as much, but we're going to talk about it briefly. But you can see, and I'm not going to read this whole page to you, but as you can see, if you're scanning those, he talks about these things in his book, and the book's about 500 pages long. I actually don't recommend it because it's painfully boring. It's got an extensive bibliography. If you really want to get into the weeds about this, it's a good book for you. A much easier book to read is his follow-up book, which is called Why We Get Fat and What to Do About It. It's about 200 pages long. It's much easier. Leaves out some of the nitty-gritty, like way in the weeds science stuff, but still a very good read. And talks about the same issues that he talks about in this one. So, other thing worth noting is that it's pretty sad because this, in the health world, nutrition world, when people are talking about eating better, this was out over 10 years ago. But by and large, big medicine hasn't changed much, despite people asking these questions about, hey, are we really supposed to be scared of fat? What actually causes obesity? People have been digging into this for some time, and big medicine is not changing very fast to accommodate the new information that we've learned. So some actual nutrition questions we're going to talk about. What should I eat? Is fat bad for me? The answer is no. Do I need to count calories? My answer to that would be never again. It's a complete waste of time. It's interesting to note that of all the species on the earth, we're the only one that count calories. And we're also the only species on earth that has an obesity problem. My doctor said do this, or my mother-in-law said do this. And that's up to you and who you want to argue with more. So it depends on if you want it quiet around the dinner table or at holidays or want it a little more interesting. You can argue with your mother-in-law about that one. So this slide generally shows how we've been taught, or what we've been told about fat causing heart disease, right? You eat butter. Butter's primarily saturated fat. It's solid at room temperature, so it clogs your arteries, right? Well, just on the face of it, it doesn't make any sense, right? Butter is solid at room temperature, but my body's not room temperature. It's almost 30 degrees warmer than room temperature, so that doesn't make sense. We've also seen pictures or commercials that show like being fat poured down a drain, saying that that's how it clogs your arteries, right? Like as soon as you eat it, it goes right into your arteries. It's funny because nobody ever says, hey, when you eat that apple, it goes right into your arteries. When you eat a steak, it goes right into your arteries. Like people don't say that about other foods. And I have realized there's a difference between how fat and protein or carbs are processed in the body, but nothing goes directly into your arteries. So just the whole thing doesn't make any sense. That's not how this works. I'll show you a slide a little bit later on that actually talks about what actually causes heart disease, because it's way more complicated than just eating butter. As a side note, some of you have tried this. When I've spoken to some of the classes, some people are trying this. This is what my coffee looks like every day, although not quite as neat as this, but I put butter in my coffee every day. Some of you are thinking that's crazy. If you Google bulletproof coffee, there's a guy who has a whole shtick about medium chain triglycerides, which are the best part of the fat of coconut oil, and putting butter in his coffee. I'm not a fan of that. Something to note, if you try that, go easy. That combo of the butter and the medium chain triglycerides in the coffee can go through you rather quickly. So for those of you that have tried this, no. And for those of you who want to try it, again, just take it easy. But the reason I mention it here is that this is what my breakfast looks like most days. It's also a good step to something like intermittent fasting, which we'll talk about a little bit later, but not a bad way to start your morning. All right, so let's dig back into the history a little bit here and actually talk about what you would have been told to eat if you had diabetes in the early 1900s. So there was two main sort of thoughts on what caused chronic disease back in the late 1800s, early 1900s. There was more folks in Europe that actually thought that sugar was the biggest culprit that caused chronic disease. One of the most popular guys was named Yudkin. He wrote a book called Pure, White, and Deadly, not referring to cocaine, but actually referring to sugar. And then in the United States, there was more folks that thought that fat was the issue, and we'll get into more of their stuff in just a little bit. But if you actually had diabetes, and I should make the caveat that in this presentation, when I'm talking about diabetes, I'm talking about type 2 diabetes, which is the vast majority of diabetes. Most people that get diagnosed with diabetes as an adult have type 2 diabetes. There's some rare exceptions that you can be an adult and get diagnosed with type 1, or like there's some people talk about a 1.5. For the vast majority of people, adult onset diabetes is type 2 diabetes, and that's the vast majority of diabetes that we see in this country. So type 1 is a different monster. But anyways, going back to this picture from a cookbook, I don't know who Rebecca Oppenheimer is, but this is a cookbook. You can Google this, find this online. So before 1920s, if you had diabetes, again, type 2 diabetes, this is what you would be told to eat. So that table on the left, or on the left side of your screen, shows cheeses and creams. Butter's top of the list. Down the bottom, under the meat section, you have bacon, which is top of the list, which is an excellent food, and then fish as well. So those are all the things that you can eat a lot of. Specifically, it says on the right side there, you'll look and it says foods strictly forbidden. So these are things you should not eat. Sugar is top of the list. Grains are in there, anything made with wheat, biscuits, cake, cookies, muffins, all those sorts of things. So before the 1920s, again, if you had type 2 diabetes, you would be told this is what you should eat. This is a picture from Gary Taubes' book. And again, this is sort of a much more concise format. This is what you would be told to eat. The foods to be avoided at the top there: breads, cereals, potatoes. So essentially sugars and starches. But eat as much as you want of meat, fish, birds, green veggies, cheeses, eggs, and fruit if it's not sweet. So the big thing that changed in the 1920s is that a doctor named Dr. Banting developed insulin so that we could now give patients insulin. We're going to talk about insulin later and what it does, but for purposes of this, it's important to know that insulin lowers your blood sugar. So the management of type 2 diabetes changed after the 1920s. And again, for type 1 diabetics who don't have any insulin, it was a great thing. That's why he won the Nobel Prize for developing insulin. The downside is that type 2 diabetics most often already have too much, but we know if we give them more, we can get their blood sugar under control. So instead of telling people to eat better, we now get their blood sugar under control with extra insulin so they can eat whatever they want. Skipping ahead a few years now from the 1920s into the 40s, 50s, there's a thing that called the diet-heart hypothesis. So what is that? What does that mean? Where did that come from? A key thing to think about there is that it's called a hypothesis, which is sort of an idea. It's something that needs to be studied and tested. It's not fact, as it often is portrayed nowadays. But the biggest players in this, the guy on the left there is Ansel Keys. He was a researcher at the University of Minnesota. After World War II, heart attacks were on the rise in this country. Ansel Keys, he actually developed a K ration for World War II by doing starvation studies on conscientious objectors. But then he shifted his focus and was looking at what caused heart disease. His ideas were that it was cholesterol, saturated fat, and fat intake in your diet that caused heart disease. So he did lots of studies pushing those ideas. Eventually he sort of gave up on the cholesterol and really centered on the saturated fat issue. But we'll talk about actually what he found and what he didn't find. He did, and then at a presentation in 1955 was when the first time this diet-heart hypothesis was officially named, but the research about it had been going on before that. In the same year, Eisenhower, picture on the right there, was in the White House. He had a heart attack in 1955 that put him in the hospital for quite a while. So this was on the consciousness of the American public. There was sort of a push to figure out what caused heart disease and to do something about it. Again, this was before Google or the internet, so you couldn't read for yourself on what was going on. But the government was saying, okay, there's everybody's having a heart attack. The president even had a heart attack. We have to do something about this. So Ancel Keys did studies, a number of studies, but in a number of presentations along the way. One was called 6 countries. One was called 7 countries. It started in 1956, and then he published data into the 60s and 70s that said that if you ate more fat, specifically saturated fat, you had more heart disease. And he published some really nice graphs that showed that this was the case. What he doesn't mention, though, and that other researchers pointed out, was that he had data for like 22 countries when he published one of his papers about only having data from 7 countries, or the 6 countries. And so when you publish all the data and look at all the data and what all those countries eat, his correlations were not as profound and as bold as he made them out to be. Despite that, he got lots of journal time. It wasn't airtime back then, but he got lots of journal time. He wrote plenty of articles. Anybody who argued with him, Ancel Keys would essentially rip that person apart and rip apart their research. And so it became the prevailing thought, essentially because he shouted it loud enough and long enough, that saturated fat caused heart disease. So the other thing that happened at the same time was that Eisenhower's doctor was Paul White. And between Ancel Keys and Paul White, they started what essentially became the American Heart Association early on. It wasn't called that. It went through some name changes over the years, but they formed the American Heart Association in its early days, and they both agreed that low fat was the answer. They actually put Eisenhower on a low-fat diet. Turns out he went on to have more heart attacks. Turns out it was probably his 3-pack per day smoking habit that caused his heart attacks. Probably had nothing to do with the fat in his diet. Skipping ahead a few more years, there was a report in 1977 from the McGovern Committee that recommended a low-fat diet for everyone. Interestingly, this was only studied in men at this point, and it had been studied very poorly, but it became policy. And then in 1980, they put out the Dietary Guidelines for Americans, which was put out by the USDA. Some interesting side notes about this are that if you look at the bottom of that, it's mostly grains. At the same time, in the 70s and 80s, we're trying to export grain to the world. So the USDA can't very well come out with a food pyramid that doesn't have grain at the bottom, right? And if they knew grain wasn't actually good for us, that doesn't help trying to export grain to the world, right? So there was certainly some conflicts of interest when these first recommendations came out about what we should be eating. Another thing that's worth mentioning is that starches are really just chains of sugar. So if you look at this picture down that second line, you have disaccharides, which is just 2 sugars together. The one on the far left there is sucrose. That's common table sugar. It's made up of 50% glucose and 50% fructose, which again are like the single molecules at the top of the picture there. Interestingly, high fructose corn syrup is made up of 45% glucose and 55% fructose. So very similar to table sugar in terms of its actual chemical makeup. But again, the key part of this slide, though, is looking at the bottom. So those starches that you eat, and starches, again, are grains, potatoes, rice. They're just chains of sugar, and they're processed in your body about the same. So there's not a huge difference. There's certainly things that are worse about fructose. There's things that are worse about sugar, but in terms of your total carbs that you're eating, starches certainly fit and should be counted as your total carbs that you're eating. So again, going back to this food pyramid, the bottom of that is all starches, essentially. So I was born in 1976. I grew up in eating skim milk, orange juice, Cheerios for breakfast, usually Cheerios with a bunch of sugar on top. And it wasn't really thought to be harmful because that was low fat. So everything was low fat. And again, it's not that my parents did anything wrong, but that's what the government said to eat. That's what they told me to eat. So, interestingly, the sugar industry actually knew that sugar caused heart disease. So this article was published in 2016 by some researchers, some of which are out of the University of California, San Francisco, published in the Journal of the American Medical Association. They went back and looked at some documentation and essentially uncovered that the sugar industry knew that there was issues with sugar consumption. It's specifically related to coronary heart disease, so they sort of paid their researchers to not talk about it very much. Again, if you're trying to sell sugar to the world, you don't really want anybody talking about the downsides of sugar. There's some other papers that I've actually looked at and covered documents that they actually knew that it was related to cancer as well. And again, they sort of just they didn't talk about that much at the time. Another interesting note is that American blended cigarettes are actually dipped in a sugar slurry. because it changes the sugar content of the, well, one, the tobacco leaves actually have a higher sugar content than they used to, and then you also dip it in a sugar slurry because it changes the acidity of the cigarettes, which makes it much easier to inhale. Just like when you smoke cigars, nobody really inhales cigars because it's very basic. It's hard to inhale deeply. The acidity of cigarettes makes it easier to inhale, so you can get all that crud way down deep in your lungs. So think about that the next time you light up if you're somebody that smokes. Skipping ahead a few more years, then into 1984, the National Cholesterol Education Panel. That's the same group that recommends what your cholesterol should be, and they keep coming out with new recommendations, and pretty much they all center around your LDL, which we're going to talk about in a little bit, and certainly at the end we'll get into what your cholesterol panel looks like. There's a few problems with that, specifically related to this slide, is that folks that have looked at this conference and interviewed people that were actually there, namely Nina Teicholz in her book The Big Fat Surprise, talks about interviewing some experts who were there. They essentially came to the conference with this consensus statement already printed and just gave it to everybody and said, here, please sign this. There wasn't actually much debate about this consensus this consensus statement. And as you can see there, they say that clearly this establishes beyond any reasonable doubt the close relationship between elevated blood cholesterol levels and coronary heart disease. So the statement was far overreaching. The data, which we'll talk about next, did not show that. There was groups among that oppose this. The American Academy of Pediatrics, for one. If you know anything about breast milk, it's very high in fat content. So that's what we think babies should be fed, which makes sense. That's a good thing. So it's odd that then you would switch to immediately going to low fat once you were done nursing. So the American Academy of Pediatrics tried to resist these recommendations that everybody should be eating low fat. Again, at this time, the only people that had been studied on were adult men. There were no studies on kids, no studies on women. But eventually the American Academy of Pediatrics was overruled, along with pretty much every other group that had any disagreement with this group. And this became the dominant theory that you had to eat low fat. Everybody had to eat low fat. That was actually the 1984 cover of Time magazine, which has made us scared of bacon and eggs ever since that time. So some of you probably remember throwing away the yolks of your eggs. I know I did it for a long time when I was in the Navy. Back many years, I'd throw away the yolks, worried about my cholesterol. It never made any sense. So I certainly don't anymore. All right, so what does the evidence actually show? So you think somebody should look at this, right? Well, in 2016, somebody did. Zoe Harcum is a researcher out of the UK. She has a BA and an MA in economics and math from Cambridge, and then got her PhD in public health nutrition. So this was the name of her 2016 thesis. So she looked at all of the data, the randomized controlled trials, which are the really good ones that compare two populations and just changing one variable. They're very expensive and very hard to do, with all the epidemiological data. In the nutrition world, that's the stuff like what Ansel Keys did. It's also really bad science. It's been critiqued a ton in recent years because most of it's based on food surveys. So it'd be like asking all the people in this room, how many times did you have broccoli in the last 3 months? How many times did you eat a hamburger? How many times did you have a hot dog? How many times did you have an apple? And looking at all these total numbers and all of these people, and then if some particular part of the population has a higher incidence of a disease, you would look back and say, okay, well, they had broccoli 3 more times a month, and the other group that didn't have the disease had broccoli only 2 times a month, so maybe it's the broccoli. Okay, there's big issues with that. One, most people can't remember what they ate for food yesterday, let alone to think back and accurately remember what you ate for 3 months. So anyways, that's the kind of data that epidemiological evidence is, and especially, again, in the nutrition world, it's not very good. But she looked at all the data that was available in 1977, and that's when the McGovern Committee looked at this. And then 1983 was when the equivalent UK committee looked at this. So these were her conclusions. So the evidence available to the dietary committees at the time the guidelines were introduced did not support the recommendations made. You think, well, that doesn't make any sense, but that's actually the facts. The committee making the report didn't actually have a bunch of researchers on it. There was disagreement with the committee. Things politically, there was pressure to move ahead and make some recommendation to the public, again, to reduce heart disease. The people meant well, but the evidence didn't support it. Her conclusion number 2 is that the evidence currently available offers no additional support. So the bottom line is that fat never caused heart disease. The evidence didn't support it when the recommendations came out. The evidence doesn't support it now. So saturated fat does not cause heart disease. Never did. This is actually a more accurate picture that explains what causes heart disease, and it's a little more complex, as you can see. You'll note that LDL cholesterol, which we talk about as the bad cholesterol, plays a small role. You'll notice that there's actually no butter anywhere on this slide. So the things that we do know, and before I get into some pieces of this was drawn by a guy named Ivor Cummings. He's an engineer out of Ireland, writes for a website called dietdoctor.com. Dietdoctor.com is probably one of the best websites that I recommend to patients when it comes to eating better, specifically low-carb eating. So they have great stuff on there. Most of it's free. If you want to sign up for a membership, it's $9 a month, but you actually get a 30-day free trial. The reason I would do that and why I did that a few years ago, not because I hold any stock in the company, but they have a ton of videos to watch. There's documentaries about nutrition. There's a bunch of short clips from experts, Jason Fung in particular. Again, we'll talk about him later when we talk about intermittent fasting, but you can sign up, pay your $9, get your month free, binge watch all of the things that you want to watch, tap into all their resources, and then if you don't like it, cancel your $9. But for me, it was a pretty good investment to spend some money, a very small amount of money, to actually get more details on some of these topics, which was very helpful. So again, dietdoctor.com. So the pieces of this that I want to talk about specifically are interesting. So this is high blood glucose, which usually turns into full-blown diabetes. Increased abdominal obesity, so that's the fat you carry around your middle, which is actually quite a bit more metabolically dangerous than fat that you carry in other parts of your body. We also have high triglycerides, low HDL, and high blood glucose. And again, those 5 pieces are called metabolic syndrome. So we'll talk about that more in a second, but we know you have much higher risk of heart disease if you have a couple of those or 2 or 3 of those, or certainly if you have all of them. So we'll talk about that more. And metabolic syndrome has been described since 1988, so over 30 years ago, by a doc named Gerald Reaven. We know you have a much higher risk of, if you don't have full-blown diabetes, you get full-blown diabetes and you get heart disease and heart attacks. So those are the main pieces of it. High blood sugar, high blood pressure, low HDL, high triglycerides, and abdominal obesity. So those are not in question. The evidence behind this causing high risk of heart disease is pretty well established. The exact mechanisms are not, and if you go back to this picture, you look at that blue box to the left, indicates there's things not related to insulin resistance. There's other mechanisms going on. So again, all of these little lines are not completely well understood. We understand pretty well some big pieces of it and the complications from it. Another thing that doesn't get talked about very much, and I don't have time to spend a lot of time on it in this talk, but fatty liver disease is a big issue. There's some pretty scary estimates about the number of livers that we will need in the future for liver transplants related to fatty liver disease, especially in kids. I believe from what I read, the youngest patient diagnosed with fatty liver disease is 2 years old. And that's not, when you hear fatty liver disease, often people think of alcoholic liver disease. And that's, yes, that hepatitis C and cirrhosis is what wrecked livers till the present day. But non-alcoholic fatty liver disease is going to be the monster that wrecks livers into the future. It's pretty scary, the estimates of how damaging that is. And I can also speak to the fact that in the ER, when I do a CT scan on somebody or I do an ultrasound to look for some reason for their belly pain, maybe I'm looking for appendicitis, so I do a CT scan. The scan comes back, no appendicitis, and oh, by the way, you have fatty liver. They call it hepatic steatosis. Or I do an ultrasound to look at a gallbladder. The report comes back, no gallbladder disease, but you have fatty liver disease. So I see it more and more, and we don't really talk about it. We don't do much about it. It's something really the primary care system has to address, but it really comes from eating sugar and eating carbs. Fructose in particular is one that can really wreck the liver because the pathway for fructose is not the same as glucose. So skipping ahead here. The other big part of this picture is this. Okay, so insulin resistance and hyperinsulinemia is the issue. Insulin resistance, we're going to talk about what that looks like. Hyperinsulinemia just means high insulin in your blood. Just like you've heard, hyperthermia is high temperature, hyperinsulinemia is high insulin in your blood. And that creates a vicious circle of high blood insulin, insulin resistance, i.e. the cells aren't listening to what insulin is saying to do. And that's the issue. A couple of side notes that we'll expand on later is that it's really the continuous doses of insulin over long periods of time that causes damage. So an occasional shot of insulin in your system and high blood insulin, not a big deal. It's the constant hammering of your cells by insulin that causes the issue. The other big piece to keep in mind is that when you have high insulin, it's a storage hormone, so it locks fat into your fat cells. You can't burn your own fat stores if your insulin is high. So, and again, we'll come back to those things. So looking at this another way, this is a slide from a group called Specialty Health out of Reno. They work with Reno Fire and Police and then have expanded also to other cities, including San Diego. And they're trying to catch officers and public safety folks before they get down the path of diabetes, all other complications of insulin resistance. Their point in this slide is that insulin resistance relates to all these other things. And again, some of the pathways are very well understood, some not so much. But when I went through medical school, all of these things were sort of explained as a different thing causing each of them. Like something caused stroke, something else caused heart attack, something else caused high blood pressure, something caused diabetes. They're probably all related, and the best folks talking about this agree that insulin resistance and the accompanying inflammation that goes with that causes all of these other chronic diseases. Breaking it down this way, this is again a slide from Specialty Health that they've let me borrow. But this is how they talk about the breakdown of a first responder's career, the metabolic breakdown. So on the far left there you have WNL, which means within normal limits. You get early insulin resistance, metabolic syndrome, with those 5 things that we just talked about, pre-diabetes, type 2 diabetes, and type 3 diabetes or Alzheimer's disease. So the scary part about this to me is that, say you get diagnosed with diabetes. You go to your annual physical and your doctor says, yep, your blood sugar's in diabetic range. They're going to probably have you come back the next day. Well, depending on how I did. If it's really high, they'll probably say go to the ER that day and then I'll see you and we'll have a conversation about this. But if it's just a little bit high or meets criteria for diabetes, they'll say come back the next day. They maybe do another test and confirm that, yes, the blood sugar is really that high. You have diabetes. That doesn't mean that you got diabetes that day. That means that you've had insulin resistance going on in your body, probably wrecking your cells for months to years before that. And now it just came to our attention. So the horse is already out of the barn at that point. And again, there's folks arguing that, as this slide mentions, that Alzheimer's disease, which we know is rampant, and the population that has Alzheimer's disease is growing. Some people refer to that as actually type 3 diabetes. So again, all those pathways aren't completely worked out, but there's certainly folks looking at this that sort of think this is what chronic disease looks like. So we need to catch people in the insulin resistance phase much earlier. This is a quote from an expert here, and the reason I mention this one, again, relates to the insulin resistance. And don't worry, in the next slide we'll talk about insulin. In just a few more slides we'll talk about this, what insulin actually does in a few more details. But Thomas Dayspring he goes by Dr. Lipid on Twitter. This is actually a tweet to Ivor Cummings. He's the guy that made that complicated slide that causes heart disease. But Dr. Lipid, Thomas Dayspring is a lipidologist. So he is probably one of the top 5, maybe even top 2 smartest guys in the United States when it comes to lipids. So I listened to a recent podcast with him. It was 5 parts long. It had a glossary of terms I had to print out, and I still can't completely follow everything that he says. Suffice it to say, your standard lipid panel, which we're going to talk about at the end of this today, just because I know that's what most people are familiar with, that doesn't adequately describe what goes on with your lipids. It's way oversimplified. This guy knows the ins and outs of lipids. The list of terms and the risk factors, which ones are risk factors, which ones are not, which ones are genetic, which ones you can control, it's way in the weeds. There's way more going on behind the scenes that we don't really talk about. Okay, so this guy knows his stuff. So the quote that he tweets to Ivor Cummings, the current NHANES data, and that's a big database of patients that they've studied and reported other things from. He says the majority of MIs or heart attacks are explained by insulin resistance. Okay, let me say that again. The majority of MIs or heart attacks are explained by insulin resistance. But the real message is, unless greater than 200, your LDL cholesterol is a terrible biomarker. Okay, so the very thing that you've probably talked to your doctor about, you've had a lipid panel done most likely. Some of you are actually on your phone right now calling it up on your MyChart and looking at it. Your LDL, unless it's really, really high, is meaningless. Okay, and of all the people in the world that would know this, it's this guy. So I trust his word on LDL cholesterol and if it matters or not. And if the guy that knows lipids inside and out says that insulin resistance is the bigger issue, I think it's worth paying attention to. So let's actually get into the weeds about insulin. And again, I don't want to bore you with the science of this, but I think this is very important to understand what insulin does for a number of reasons. But specifically, then when we talk about strategies for eating, it will make a lot more sense about why we want to eat the way we do. So insulin is released from your pancreas when you eat food. It primarily comes from carbohydrates, so sugars and starches. Again, sugars and starches raise your insulin. If you eat a lot of protein, you also raise your insulin. A moderate amount of protein doesn't raise your insulin very much. And fat does essentially nothing to your insulin. So again, carbs gives you a huge insulin spike. If you eat too much protein, you get an insulin spike. Fat does nothing. Okay? And insulin is a storage hormone. It allows your cells to use glucose that's in your blood. Your body knows that's toxic, so it releases insulin to get the blood sugar out of your blood and put it into your cells. You have 3 options for where that gets stored. It goes into your muscles, it goes into your liver, and it essentially gets stored as glycogen in your liver, which is essentially starch that your liver can then release later on if it needs to. Or it goes into your fat cells. Those are the only 3 options. And once your muscles and your liver are full, which is only about around 400 grams, give or take a little bit, maybe or about 500 grams, so like 100 in your liver, about 400 in your muscles, a total of about 2,000 calories worth of sugar or starch stored in your body, in your liver and your muscles. Anything beyond that has to go into your fat cells. So, and when your insulin is high, it keeps fat locked up. It's either storing fat or keeping it locked up. The other big thing that this does is that your insulin acts on your kidney to retain sodium and water. So that causes high blood pressure. There's a much bigger effect of insulin probably causing high blood pressure than salt ever was. I hate to tell you folks that think that salt's the issue. Salt is really not the issue for high blood pressure. It's a very small percentage of the population that actually matters. The vast majority of people can eat as much salt as they want. How do we know this? Well, one, there's also been books written about why salt's not such a big deal. The data behind that's not very solid. If you look at some of the numbers and studies that look at low salt diets, it might drop your blood pressure from an average of 180, which is pretty high, to 175. So even the best folks that are compliant with that don't make a meaningful or a clinical difference in their blood pressure. The other data that's coming out comes from Virta Health. And again, I don't have any ties to anybody, but Virta Health it's an online diabetes reversal clinic working to reverse diabetes, which we're going to talk about more later. But from their data that they're releasing, they not only get their patients off diabetes medications, they're also able to come down on their blood pressure medications. It seems to be a slower switch. The diabetes medications come off pretty quick. The high blood pressure medications are slower to come off, but they're making a big dent in those sort of folks. So the other thing, again, the last point in this slide is that it's the constantly elevated insulin that's dangerous. So spiking your insulin now and then, not a big deal, but constantly hammering your cells with insulin is a problem. Just like if you go to the shooting range and you hear a gunshot or a loud noise, that doesn't wreck your hearing. But if you're at the range every day, constantly hearing loud noises without hearing protection, you're going to wreck your hearing. Insulin works the same way. In cartoon format, looks like this. Over on the left, you see glucose at the top. Insulin acts like a key that goes in a lock. Once it goes in that lock, it turns the lock. The channel opens, and then glucose gets out of your bloodstream into your cell. And that works on liver, muscle, fat cells. It works pretty much the same on all the cells, more or less. So, this next slide is this is a video online that explains this a little bit better.
Most of us think we only put fat in our fat cells when we eat too much. But as Gary Taubes explains in Good Calories, Bad Calories, your fat cells are like rechargeable fuel cells. Every time you eat, you store some fat. In between meals, fat comes out of your fat cells to provide the fuel for your muscles and organs. If you're naturally thin, it's because you have efficient fat cells. Fat goes in quickly and it comes out easily. Your body doesn't need much fat because the little bit of fat you do have is a reliable source of fuel. If you're predisposed to be fat, it's because you have greedy fat cells. When you eat, you tend to store calories as fat instead of burning them. And when your other tissues need those calories, the fat comes out slowly if it comes out at all.
What are they doing? Did one of you guys forget to pay the food bill? Are you going to eat all that?
The end user of food that we eat are our individual cells. And it doesn't matter if it goes in our mouth. If it doesn't get to those cells, we starve. We starve at the cellular level.
And so you do exactly what your body is telling you to do.
Come on, eat something. Steak, will ya?
You eat more. In other words, you're not getting fat because you're eating more. You're eating more because you're getting fat. Most of us weren't born with greedy fat cells, but we can certainly make them that way. When you eat too many carbohydrates, you raise your blood sugar. Since high blood sugar is toxic, your body releases insulin to bring it down. But your body can only burn a little bit of sugar at a time. So what happens to the rest of it?
Your storage sites for carbohydrate are limited, and we've got unlimited storage places for fat. So the body ends up just converting the carbohydrate to fat.
And after bringing down your blood sugar, insulin does its other job. It tells your body to store fat. When you have a healthy metabolism, it only takes a little bit of insulin to bring your blood sugar down, and then everything goes back to normal. But over time, that can change.
The cells can become resistant to the effects of insulin. In essence, when that happens, insulin's talking, but the cells just aren't listening. And so they don't get the message from insulin, so they don't do what they're supposed to do.
Hello? Stop hitting me. I'm not hitting you. Stop hitting me. I'm not hitting you.
And so your body does what it has to do. it starts producing more insulin.
You finally reach the point to where your insulin's high just to keep your sugar normal, even if you're not eating any sugar. And then when that happens, then it's starting to drive stuff into the fat cell, and then you've reached this point where all of a sudden, bam, you get fat.
Fathead, yeah, I'm gonna start thinking smarter.
All right, so that guy's a little bit quirky. His name is Tom Naughton. He did a movie called Fathead that actually, he eats fast food for a month and actually loses weight and improves his cholesterol. Before you guys all jump on that and go eat fast food all the time, that doesn't mean fast food is healthy. But what he does is he limits his carbohydrates to 100 grams a day. He actually tried to contact the producers of Super Size Me, which may be a movie that you're more familiar with, and asked him what that guy actually ate, Morgan Spurlock, a much older movie. They didn't give him his actual diet. Tom speculates that he was probably chugging even more soda than he let on in the movie, which is why he got so sick so fast. So anyways, you can Google him. He also did his movie, or this video here is called Why You Got Fat, or Why You Got Fat, Why You Get Fat, something like that. He also did a recent talk for the Weston A. Price Foundation, which is very helpful, which really succinctly summarizes why we have the dietary guidelines we do and why they don't make any sense. So, all right, last thoughts on diabetes. So again, type 1 diabetes, the treatment is insulin. That makes sense. You don't have enough if you have type 1 diabetes. Type 2 diabetes, you go to the doc, you're going to be told to eat the food plate, which we're going to talk about in a bit. Metformin, which is not a bad drug per se, but it doesn't do a whole lot for your blood sugar. It'll give you other drugs, which essentially whip your pancreas into making more insulin for the most part. And then you're going to get insulin. Okay? And I would argue very strongly that this makes no sense because this is the thing that you already have too much of. A better option would be stop eating the things that raise your blood sugar. And if you're a diabetic patient, and I have this conversation with diabetic patients, you don't have to believe me. You don't have to take my word for it. But if you eat food and you have a glucometer and you can check your blood sugar, see what your blood sugar is doing after you eat particular types of foods. Because if your blood sugar is going way up, that's the answer. Like, you've proven that that's not a food that you should be eating regularly. So, all right. Switching subjects from getting off topic of insulin for a bit. We'll come back to it later. But some of you are thinking this, right? I'm not fat. Or you're thinking, oh, I'm young, this doesn't apply to me. Before you get all excited there, know that lean doesn't guarantee health, right? They're not synonymous. This is from a talk called Fructose 2.0. It's done by a guy named Robert Lustig. He's a doc out of UC California, San Francisco. You'll know it's him when you hear him do his talks online. Because he refers to fructose as fructose. He's a little bit of an odd guy, but to him it's high fructose corn syrup. I don't know why everybody else calls it fructose, but his first talk, I believe, was called Sugar, the Bitter Truth, which went viral around 2011, I think. And then this was one of his other talks online. So this is a slide from that talk. So he estimates of the 240 million adults in the United States, that red circle there on the left, about 30% of the population are obese. They pack on more fat into their fat cells than the average person. About 70% of the population, that blue circle on the right, they're normal weight. So probably because of what Tom explains in his video, but they have efficient fat cells. They don't carry the stigma of being obese. They're not fat. Of that 30%, now back on the left, Lustig estimates about 80% of those folks are actually sick. So they're going to have high triglycerides, low HDL, diabetes, prediabetes, hypertension, all of those same things going on. And it's interesting when I saw this because I can tell you that I've seen 400 and 500 pound patients who don't have any metabolic problems. So they're in that small slice of the pie that they're really obese, but they actually don't have metabolic problems. Maybe like in that 20% if his estimates are right, which doesn't make any sense to me, but there is a sliver of those folks out there. Conversely, the more scary thing about this slide is the normal weight folks. So he estimates that of that 70% that are normal weight, about 40% of those folks have the same metabolic dysfunction. So diabetes, prediabetes, hypertension, high triglycerides, low HDL, the same thing going on. Furthermore, those folks that estimate or would guess that the people that are normal weight with the metabolic dysfunction have worse outcomes than the people that are obese with the metabolic dysfunction, because being obese is a protective mechanism to the body. So there's lots of public safety folks in that category. They look well, they eat like a garbage disposal, they go, they die of a heart attack, and people are just astounded because they looked healthy. And again, looking healthy does not guarantee that you are healthy. A quick couple slides, just talk about calories briefly. So Jason Fung wrote The Obesity Code. He's written other books called, I believe the other one's Diabetes Code and some other ones. He has a website. He does great work with diabetic patients. He specifically is a nephrologist in Toronto who works with people who have kidney failure. The biggest cause of kidney failure are diabetes and hypertension. So he has lots of experience with these folks. He talks about in his book, this quote here, that when a 30% reduction in calorie intake is quickly met with a decrease in basal metabolic rate of 30%. And what that means in layman's terms is obvious to anybody who's ever tried a calorie-restricted diet. So say you eat 2,000 calories a day, and now you switch to 1,500 calories a day. You're going to lose some weight initially, but you're also going to be more tired and more hungry. So your body sort of shuts down its basal metabolic rate. It stops burning energy because it's trying to conserve calories. So you'll lose some weight, and then that stops. And then you reduce your calories further to 1,200 a day. So again, you lose a little bit more weight, but then your body adjusts, and then you're tired and you're hungry, and all you think about is food, and you're miserable, and you don't sleep, and everything just goes downhill, and then you throw in the towel and say, forget the low-calorie diet, I'm done. And you gain all the weight back. So that's one problem with calorie-restricted diets. They've never been studied to prove to work long-term. Never, ever. No study that's ever looked at low-calorie diets has ever proven long-term success. The other thing about the other false assumption is that we consciously control how much we eat. It's way more complicated than that. The overlapping hormonal systems that exist to control body fat are way more complicated than us simply making a decision to eat less calories. And you'll see these calculators like in magazines at the checkout or online. It says if you eat 20 less calories a day, they'll lose so many over the course of a week. It's this many calories, and then over the course of a year, it's this many calories, and that equals a pound of fat. It's nonsense. We do not have it dialed in that close in terms of counting calories. So it's a waste of time. All the effort that you would take counting calories, just forget doing it. Spend it on something else more useful. If you look at these two meals, say you have an equal amount of calories from whatever that steak and peppers, whatever's in there, with Coke or Pepsi, the hormonal effects on your body are completely different. So this is not the same thing. But if you go to like Coke and Pepsi vending machines, they're going to have a little sticker on there that says, just balance your calories, right? Balance your in, balance your out. Drink as much calories as you want. Just balance your burning your calories. It's nonsense. It completely discounts the hormonal effects that are going on, which are way more complex than just calories in, calories out. The first law of thermodynamics is true, right? A calorie is a calorie. That is true. But that only works in a test tube and in the lab. That does not work in the human body. It's way more complicated than that. All right, so now what? Again, the bad news, this is not the food plate you should eat. This is the chronic disease plate. This was born out of the food pyramid originally, then turned into this. If you eat this way, it's a good chance you're going to get chronic disease. So if you go to a website, they're going to tell you the stuff at the bottom. Eat diets that's low in cholesterol, low in saturated fat, low in salt, yada, yada. Whole grains, healthy fruit, healthy fats, fruits, vegetables, all that, right? And ask your dietitian or doctor for more advice. Your doctor or dietitian, nothing against folks in primary care. They have a very difficult job talking to patients. We also have a system that tells them that this is what they should be telling patients. So unless you research it on your own and spend time looking into this is what you would be told to do and what the big system tells you to do. So they will tell you to eat exactly what's printed there as well. You may get advice like this, that you have to eat breakfast, the most important meal of the day. You have to eat every 3 to 5 hours, 3 to 6 meals per day. Don't eat after 6 p.m. So any of you out there that are dog watch, do you eat breakfast when you get home from work, or do you count that as like your evening and so it's after 6 p.m. so you don't eat breakfast? Because which one of these rules are you supposed to follow? Which one of these matters more? Okay. Yeah, the point is none of them make any sense. Virtually every study that looks at eating breakfast as the most important meal of the day is done by people that make breakfast products, right? General Mills, Kellogg's, Quaker Oats. Other studies that are independently funded don't find the same correlation, or they find a negative result. So there's no magic to breakfast. And we'll come back to talk about that later when we talk about intermittent fasting, but there's nothing magic about breakfast. So the easier way is to just eat when hungry until full. 5 words. Eat when hungry until full. How does that work? Well, if you eat more fat, this works. So fat fills you up. It tastes good. You don't have to weigh and measure things. You don't have to count calories. This is a much easier way to eat. So again, if you're sleeping, wake up, pay attention to this slide. This is the general theme about how I recommend folks eat. Is low carb, high fat. So it's meant to be a lifestyle and a tool to use. It's not something to do and like, okay, then I'm going to go back to eating regular. Like, no, this is switch to eating this way. Most of us would do better. Again, it should be moderate protein. So if you look at that next line there, fat, protein, carbs is what you should eat. And if you think back to the insulin slide, that's exactly the opposite. You eat foods in proportion to what they do to your insulin. So fat doesn't do anything to your insulin, which is what we want. We don't want insulin. Eat a lot of fat. It doesn't do anything to insulin. Eat a moderate amount of protein, not high protein, because that's going to spike your insulin. and don't eat very many carbs because that's really going to drive your insulin. So you eat your foods in proportion to what it does to insulin. So there's no absolutes to this. We'll talk about some strategies that help with that. It's also tailored to the individual, as we'll talk about that later too, in terms of what this actually looks like for you. How many carbs is that for you? The last thing I'll mention, in one of the talks I just gave recently, somebody asked about eating high fat and high carb. So if you're eating high carb and you add high fat, that doesn't get you anywhere. That's probably worse than just eating what you were doing. If you're eating low fat, high carb, that's one thing. But if you add high fat to high carb, you are not doing yourself any favors and probably doing more harm. So don't do that. This is a picture from a book called The Art and Science of Low Carb Living by Drs. Finney and Volek. They're actually docs that work for Virta Health. They talk about how there's some folks out there that may thrive on a low-fat diet. And I've seen this when I do this talk because people come up to me afterwards and say, hey, I eat this way. I've actually had my numbers checked. I'm looking pretty good metabolically from what I can tell. I feel good. I sleep good. My exercise is good. Like I feel fine. So there's a percent of the population that probably does okay with that. However, there's a lot more folks that would do better being on the bottom half of that pie chart. So they would actually do a lot better on low-carb diet. And as Finney and Volek talk about in this book, there's probably more people even as they age that even if they did well on a low-fat diet when they were younger, they don't do good on a low-fat diet as they get older. And a low-carb diet would be much better for them. A couple of side notes here. So the best diet 2019, this is put out by U.S. News and World Report every year. The first place was the DASH diet. We won't get into the nonsense behind that. Last place is the ketogenic diet, which is a very low-carb diet. The folks at Virta Health, who I mentioned before, specifically their CEO, Sami Inkinen, he was actually a world-class triathlete. He's a Finnish guy. He was a world-class triathlete in his age group, and literally doing the Ironman, winning the Ironman. And he was diagnosed with prediabetes. And he thought, this makes no sense. Like, how can I be pre-diabetic? I can't possibly exercise more. So he founded Virta with the docs Finney and Volek, and they actually put people on what's called a well-formulated ketogenic diet. So again, an article actually came out after that in U.S. News and World Report. This was in the Journal of the American Medical Association, talking about that. Yeah, this ketogenic diet as a tool for weight loss and type 2 diabetes is growing. From two of my favorite authors, Taubes and Nina Teicholz, wrote about this, that they're absolutely wrong with what constitutes the best diet, and I would absolutely agree with them. So this is Virta's website. Again, they use what's called a well-formulated ketogenic diet. So they're very much tailored to the individual patient. And this is their goal, to reverse type 2 diabetes in 100 million people by 2025. Okay, so a key piece of this that is game-changing is that if you go to your doctor, and again, nothing against primary care, they have a very tough job, but I have not been taught that you can reverse type 2 diabetes. It's taught in medical school as a disease that you have to manage for life. Here's your medications, you're on these for life, manage this. Okay, Virta is actually reversing this in people. With what they do, they actually reverse it, and that's a game changer. No other system is doing it. I wish I could say my system was doing this. There's no system out there that's doing this besides Virta. So the results are staggering. The success that patients are having is staggering. So what does good fat look like? All right, these are the good fats: butter, coconut oil, olive oil, animal fats. Exactly the things that you're told not to eat a lot of. When my folks come over, they're 75. They haven't been convinced that this is the best answer to eating. They're pretty well established in their habits, as you can imagine, after 75 years. They'll cut the fat off of the steak that we eat, so my kids gobble it up. I'm happy to let my kids eat the fat. My kids eat the skin when we eat poultry, the turkey, the chicken. I'm happy to give my kids fat, which is ironic because if you look back through cultures and study like Aboriginal or undeveloped cultures, the population that gets the fattiest foods are like the women and children. The choicest cuts of meat were the fatty ones. The lean stuff often gets thrown to the dogs. So very different than how we do things nowadays. But if it's made in a factory, that's not good fat. The vegetable oils, the ones that take lots of processing, there's lots of too much omega-6 and not enough omega-3, which are essential fatty acids, and we don't have time to get into the weeds of that. But and again, the oils don't necessarily raise insulin, but they cause issues and inflammation in different ways that contribute to that whole insulin resistance problem. So specifically fast food oils, they're vegetable oils heated to high temperatures, very damaging. There's some evidence of that already essentially in the lipid biochemistry world, which as you can imagine is not a big field. That research really hasn't spilled over into the nutrition world. But again, Nina Teicholz talks about this in her book the most. It's pretty scary that the vegetable oils that they use now, even though they're better than the trans fats, which replace saturated fats, which essentially animal fats that McDonald's originally used with their fries back when they first made them. And then again, over the years, that was demonized, so they went to trans fats. They got rid of those. Now it's vegetable oils, but still very damaging to the body. If you would Google a low-carb, high-fat food pyramid, it may look something like this. Very different than the government USDA food pyramid. And the other thing that's worth pointing out here that you'll see when you look at food pyramids like this is that fruit is meant to be more like a dessert. So most of us, if you're given the choice to eat vegetables or fruit, you're going to pick fruit because it's sweeter. We like it more. That's the way nature designed it. But it also means that if you don't tolerate carbs, wherever they come from, that can be a problem. So if you're diabetic and you're eating 5 pieces of fruit a day, because that's a common health thing, like 5 a day for better health, that's a lot of sugar in your diet. And yeah, I'm sure you're eating more than just 5 pieces of fruit a day, because that's not going to fill you up for the entire day. So again, fruit's not inherently bad, but it does have a much higher sugar content than vegetables. So they're not really the same thing. Here's a slightly different food pyramid. This comes from a website called Mark's Daily Apple. He refers to eating as primal or primal living. His food pyramid is slightly different. He's got meat at the bottom, then vegetables and healthy fats. But again, you'll see the same themes are the healthy fats that I just mentioned is what he calls healthy fats. He also lists foods in moderation and puts fruit up there as a food in moderation. So the same thing as what I was talking about. So the other key piece to his slide is this, and I call it the 80-20 rule. There's 2 parts to the 80-20 rule. And this is absolutely crucial, that 80% of your body composition is based on what you eat. So you can't you've heard it said you can't out-exercise or outrun a bad diet. It's absolutely true. There's some folks that think it's actually closer to 90% of your body composition is based on what you eat. So, and again, if you think about that bell curve back early on, maybe you're closer to one of those people who's 90%, maybe even higher. Maybe you're on the other end of the bell curve, and maybe it's only 70 or 60%. And maybe when you exercise, it helps you maintain your weight a little bit better. I've talked to folks that probably fit into that category. But for most of us, it's probably around 80% of our body composition is based on what we eat. So remember, that's one of the 80-20 rules. We'll talk about the other part of that in a little bit. So, and I have this conversation with patients, and I even had a guy who is 400 pounds tell me that he just stopped drinking soda and lost 30 pounds. He was down from 430, and he was just baffled that he didn't change his exercise, just stopped drinking soda and lost 30 pounds. I'm not surprised at all. That makes total sense to me. All right, so now I have some actual what I call useful strategies. This is not 5 a day for better health. It's not eat breakfast every day. And hopefully something that you see here will be helpful to you. So the next time you sit down and eat, or in the future as you're thinking about your eating, maybe something will make sense to you. You don't have to like them all. Maybe they don't all apply to you, but maybe something here will be helpful. The first one we've already talked about, don't eat on the clock. The second one is avoid the white things, right? Sugar, flour, potatoes, and rice. Another way to look at that is refined white powders are bad for you. So sugar, flour, cocaine, they're all refined white powders. They're all bad for you. Okay, and the dose makes the poison. So don't have too much of those. I don't have any of some of those refined white powders, but not much of the other one, not much of sugar or flour either. And then potatoes and rice, they're starches. They're not sugar, but they're starches along with the flour. There's nothing in those ingredients that you can't get from a better source. So again, maybe not inherently bad by themselves. I don't say never eat them, but don't eat a lot of them. When it comes up to the holidays now, which are coming up, actually, when you're watching this, it'll be after the holidays, but anytime you're going out to special events, don't go somewhere really hungry. It makes it really hard to resist the bad choices. So have something ahead of time or eat more of the healthy choices there. Don't go somewhere when you're really, really hungry. Oh, sorry. All right. So when I cook, it looks like this. I eat very simple. I got 4 kids. I eat a ton of food. If I'm cooking something, it looks like this. Take some meat, cook it, bake it, broil it, saute it, fry it, barbecue it, grill it, whatever you want. Mix it with some fat, butter, coconut oil, olive oil. Take some veggies, whatever kind of veggie you want. Mix it with coconut oil, butter, olive oil. Mix it together and eat. My wife gives me a hard time because I don't season food. To me, meat is a flavor by itself. So meat and veggies and fat. Meat and veggies and fat. Repeat until you're bored. So very simple. And these aren't actually my pictures. So I steal these from the internet. But when you think about vegetables, lots of people think of go back and think about like green beans, like the lunch lady green beans. They're cooked in this huge pan. There's probably more nutrients in the water because it's been cooked so long. The green beans are faded. They're disgusting. They have no flavor. You're told not to eat them with salt. Like, that's boring. Nobody can eat a lot of that. But stuff like this tastes good. So I'm talking, it's a pleasurable and an enjoyable way to eat. Like, this food fills you up. It tastes good. None of it is bad for you. Nothing pictured here essentially is bad for you. So yeah, vegetables, meat with fat on it. Cheese, butter, bacon bits in that one picture. Like, it's good food. It's an enjoyable way to eat, and not an unhealthy way to eat like we've been told. Like, you can put as much butter and bacon on pretty much anything you want. A side note about breakfast. Breakfast is completely optional. Again, the studies don't hold that it actually matters. There's a thing called the dawn phenomenon, which actually raises your blood sugar early in the morning. Because of these growth hormones that are released as a part of your circadian rhythms, your liver actually pumps out some glucose through a process called gluconeogenesis, which is a fancy way of saying new glucose production. It comes from the glycogen stores in your liver. So if you don't want to eat breakfast, don't eat breakfast. You don't have to. And when you think about it, look at these top two pictures, right? Cake is in the name. Okay, cake is dessert. So breakfast like this is really just an excuse to have dessert in the morning. Okay, that's not really breakfast. What's the difference between these two pictures? Muffins and cupcakes. Yeah, some of you guessed it. It's frosting. Right? That's the only difference here. So don't kid yourself. Eating a muffin in the morning is not breakfast. That's just an excuse to have dessert. So, a couple of other side notes here about soda. I get asked about this a lot, so I added this slide in not too long ago. So, soda, diet soda, energy drinks. For one, the fructose in there lights up the reward center of the brain. And again, table sugar or high fructose corn syrup are almost 50-50 or 45-55 glucose and fructose. But fructose lights up your brain different than glucose does. It lights up the same areas that get lit up with like cocaine, heroin, and alcohol. So there's also more and more evidence that artificial sweeteners, so say you're happy you're drinking diet soda, but the artificial sweeteners can cause an insulin response. So it might not raise your blood sugar, but it can cause an insulin response, which again is the root cause of a lot of these issues. Something else that happens is that your receptors and taste buds are downregulated, so you need more of the same thing to get a hit. So both in your brain and your taste buds. So the more processed, sugary stuff you eat, and specifically processed food and drinks, are very much engineered to be addictive. So they're meant to be that sweet spot where you crave them, you want to buy more of them. They're not too rich, they're not too boring, they're right in the sweet spot. So I can tell you from a personal experience, when I was in the Navy, 2008, I was drinking lots of Mountain Dew, eating burritos and pizza. And if somebody handed me a sparkling water then, I'd be like, how can you drink this stuff? It tastes terrible. Now I actually enjoy sparkling water. But I've gotten off the soda. I went to diet soda. Now I'm not a no soda, no energy drink guy, but it's a pretty rare occasion that I have that. And I can tell you my taste buds change. And actually something like sparkling water then becomes satisfying all by itself. I don't need all of the processed chemicals and other additives that I used to. The other part of the 80-20 rule is this. Eat well most of the time. So we talked about that 80% of your body composition is based on what you eat. This is what makes eating like this sustainable. So eat well most of the time. Enjoy those special occasions, whether it's a family thing, a religious thing, a holiday, a tradition. A buddy comes back from deployment, wants to go out for beer and pizza. You darn well better go out for beer and pizza, right? You don't tell your buddy, oh, I'm eating paleo right now. I can't do, like, you're being a jerk. So don't ruin relationships over food. I can speak to personal experience. My mom loves to bake, and my kids don't get to bake cookies with grandma as much as the other nieces and nephews do, or as my nieces and nephews do. So we've had some hurt feelings. We've had to navigate that, but don't ruin relationships over food. So make that be, if you're eating something that's bad for you, make it be part of your 20%. Don't get too hung up on that. And then the next meal or the next day, get back to your normal stuff and eat good. You have to change your environment to eat better. If you ever read anything about willpower being the answer, it's junk. Just throw it away. Everybody's got a limited amount of willpower in the day, and at the end of the day, you don't have any. You're out. At the end of a shift, you don't have any. So you have to make being healthy the easiest choice. Specifically when it comes to grocery shopping, don't shop when you're hungry, tired, or stressed. Everybody's heard the hungry, but tired and stressed, same thing is going on. You're not going to make good choices. But when you do shop on the edge of the grocery store. So shop on the periphery. Start with the fruits and vegetables. And again, when you're buying the veggies, think about the fact that you're going to put butter and cheese on those veggies. If you're not a veggie person, like I'm not, but if I know I'm going to put butter and cheese and good tasting stuff on them, I can eat a lot more veggies. Limit your fruits. Again, think of those more like healthy dessert. Eat lots of meat, poultry, fish. Find some full-fat dairy stuff as you come around the grocery store. Get some eggs. As a patient pointed out to me, the bakery is also on the periphery, so don't go to the bakery. Skip that part. Intermittent fasting. Now, I know some of you have tried this from talking to you. This is not so crazy. So there's pretty much throughout every history and culture, there's been a fasting component, whether it's Christ fasting for 40 days in the wilderness, Muhammad, Buddha, pretty much every culture in history has some sort of fasting element. It fits with whatever else you're doing, and it's different than calorie restriction. And again, for the sake of time, we can't get into the weeds of that, but if you want to read more about that, see Jason Fung. He's got tons of material about intermittent fasting. It's also the body's it's a natural response to illness, like an anti-inflammatory response. So you'll notice this most in kids, and I see kids in the ER, their parents bring them in, they haven't eaten for a couple days because they have a cold, they're kind of sick, they're still drinking fine, they're not eating. The parents are freaked out, they're not eating. Like that's a natural response. The body knows something's something's wrong, it's fighting infection. It's an anti-inflammatory process going on when you start burning your own fat, and so that's why your body fasts. So it's not so crazy. It's also a reset time for your insulin. So again, if your insulin's high all the time, fasting will quickly get your insulin down to normal levels. If you're diabetic, that's a different thing. It's a little different. It's not going to instantly come back to normal, but for most people, this is a reset time for your insulin. And I could ask, if I was there, I'd ask who needs more time in their day. And pretty much everybody would probably nod their head if they're honest. But imagine not having to plan, to shop, to prepare food, to eat food, or clean up after yourself. Okay, you get a whole lot of time back in your day. I used to eat about 5 or 6 eggs every morning. The last few years, it's been just butter coffee, pretty much almost every day, unless some other goofy thing to my schedule or a breakfast meeting. But I can get out of the house a lot faster, a lot easier. It's a lot quieter. Much more time my day getting out of the house. Makes my mornings easy. So this saves money. It's safe. Besides kids and pregnant and lactating women, pretty much everybody else can fast. There's even some evidence that fasting should be part of cancer treatment. And I'm not saying fasting cures cancer. Don't take away that message. That's way overstepping. But there's more and more folks digging into the fact that essentially your body, cancer cells can only burn sugar, whereas your body can burn sugar or fat. So if you stress the cancer by fasting or eating fat, you can stress the cancer, and then with traditional treatments and some of the other regular treatments, you can have better effects on cancer. So I think in the years to come, we'll see more evidence that this is a bigger piece of that treatment. So, and again, it's a simple thing to do. For most people, what it looks like is just skipping breakfast or delaying your breakfast. That's the easiest way to start. If you fasted overnight when you're sleeping, which obviously everybody does, and essentially everybody's done this, right? You've all missed breakfast at some point, and nobody in this room has died from skipping breakfast. So we've all done it at some point. This is just intentionally doing that, pushing your breakfast later in the day or skipping your breakfast altogether, and then eating starting at noon or in the afternoon or evening time. One caveat to that, I will say, if you are a high carb person, making this switch may be tough. So it's a little bit easier to make the switch to this if you've already been doing some low carb eating. Because with the carbs in constantly, your body constantly craves those, and you go up and down with the blood sugar up and down. You're not probably going to enjoy this much. But once you get low carb, this doesn't get so, it's much easier to do. It's also worth noting that burning fat, to burn your own fat, you have to have low insulin. So then once you have low insulin, you burn your fat stores. You burn your fat stores, that releases energy. It also provides sort of a slow burn, which keeps your mental function better. You avoid the highs and lows. You avoid that hangry feeling of when you need to eat more. I was notorious for that when I was dating my wife, and she hated it. But if I got grumpy, she just threw some food at me, and then I was fine. But it only lasted for a bit. So once you get more efficient at burning fat, you have a slow burn. Your energy is stable. Your mental function is stable. So, and then that energy actually leads to exercise well, which helps a lot of people. So again, the point is you have to fix the eating before you fix the exercise. A quick couple notes about whole grains. Whole grains have fiber. That's about the only thing that makes them better. There's lots of places you can get fiber. I wouldn't get it from grains. That American Heart Association gets to put that on whole grain products. There's some issues with that labeling. General Mills obviously is beholden to their shareholders. They make money when people buy cereals that say American Heart Association approved. American Heart Association makes money when General Mills pays for that thing to go on their food. There's certainly some conflicts of interest, and our health is not really top of their list. So some other issues with grain, and when I say grains, I mainly mean wheat, because that's most of what we eat in this country. Corn is also a grain. It's not a vegetable. Grains contain anti-nutrients, which impair absorption of vitamins and minerals. That can be a problem. It also have, primarily again in wheat, is gluten and gliadin, are proteins. Their tolerance, people would argue that tolerance varies for everybody. But again, depending on where you fall on that bell curve, but they're probably bad for everyone. They contribute to damaging your gut microbiome, leaky gut issues. They can also be very addictive, like heroin and cocaine. The best books on this, if you're interested in this more, are Grain Brain and Wheat Belly, written by a neurologist. Dave Perlmutter wrote Grain Brain, and William Davis, a cardiologist, wrote Wheat Belly. So I grew up on a farm, and I can tell you that we fed animals whole grain. And I can also tell you that the point of that is to fatten animals faster. So if you want a marbled steak, a really tasty marbled steak, it's marbled, that's fat. So if you're going for a marbled look, eat your whole grains. That's not me. I'm not going for marbled. So again, fiber is a good thing. Get it from other non-grain sources. You can Google where you can get fiber from other sources. The slide on the lower right there is actually from Jason Fung's material. He described, you can see in this picture there, he's got high protein causes insulin, fattening carbohydrates. He actually calls wheat a super carbohydrate. Really contributes to high insulin levels. So, and he's Canadian, that's why he can't spell fiber. But fiber is actually a protective mechanism in his scheme of things. Vinegar is good for you, but those things by themselves won't offset a really crappy diet. So they're good things to add, but you can't just eat those and expect to offset all the other bad effects of stuff you're eating. All right, so this is another slide from Mark's Daily Apple. And there's lots, I think this is important because lots of folks in public safety think that they went from the squad car to the desk and now that's why they're gaining weight their whole life. Probably not the case. I would argue very strongly it's not the case. Your activity level is not determining the fact that you're gaining weight. It's probably that your carb intake is too high for you. And again, this may vary, it varies depending on the person. But most people are, if you're up in that 200 range or above, you're in trouble. You're going to gain weight, especially as you get older. You're not going to tolerate that as well, most likely. I had a diabetic patient tell me he was supposed to have 75 grams of carbs per meal, and that was from his diabetic educator. So that puts him at 225 for the day if he's just eating that 3 meals a day. And surprisingly, he couldn't get his blood sugar under control and was gaining weight. So I was like, yeah, I'm not surprised. You're way over line on how many carbs you're eating. So most people do pretty well in what that range, that circle there. So maybe 75 to 125, somewhere in there. I'm down probably below 50 a lot of days. I feel great down there. My wife feels pretty bad when she goes that low. She's more in the probably 100 to 150 range, and she feels pretty good there. So try that for yourself. Another thing worth mentioning here is and this example comes from Randy Jurtle, who's a doc at PhD out of Duke. And just one slide on this, but there's a thing called epigenetics. And if you think of your genes as your computer hardware, your epigenome are essentially things on your genes, and that's like your computer software. So you can reprogram your genes to express themselves in different ways. So a lifetime of eating processed food is going to bite you. Eating good food and doing other things to be healthy, and your epigenetics is also affected by your sleep, your exercise, other things as well. But you can actually get your genes to express themselves more or less. So you can reprogram your genes, and there's more and more evidence that this is a thing, that we have more control over this than we once thought. A quick couple slides talk about what I eat, because this comes up, people are like, well, it's easy for you to say, but what do you actually eat? I eat low carb, high fat. I do some intermittent fasting, no absolutes. I do that because I have a family history of heart disease. My father had 5 or 6 vessel bypass when he was in his 50s. My grandfather had 4 vessel bypass, and my other grandfather had carotid endarterectomy, where they scrub out your carotid arteries, which is not something they even do anymore. So I eat lots of fat on purpose so I don't die a cardiac death. And you may wonder, well, how is that working? This is from a comprehensive cardiometabolic panel that I have done every year. This was my 2018, just a couple of months ago. By traditional measurements, everything looks good. This page is actually about a 3-page report. It has a typical lipid panel. It has some other way in the weeds lipid stuff that I don't completely understand, but from all these markers that I can tell, things are looking pretty good. I had a cardiac calcium score last year. I have one little plaque in one of my arteries. My score is 25, so I have some evidence of coronary artery disease. I wish it was a little bit better, but not so bad. I had a visceral fat scan and liver scan in 2015. This looks at my visceral fat, or the abdominal fat that I was talking about earlier that goes with metabolic syndrome. And both my visceral fat and my liver fat are both great. So I eat a lot of fat. I do not have a fatty liver. So a couple of quick other side notes here on supplements and what I call magic foods, because I get lots of questions. When I speak live, I get lots of questions about these things. So the summary is that virtually any isolated food or supplement, vitamin or mineral, etc., does not do what experts claim it does. So the media loves to jump on these things and say that this is, this cures this. Like blueberries are antioxidant, right? There's no single food that is the answer, okay? Oatmeal and cholesterol is a common one. Like, oh, you eat oatmeal and you lower cholesterol. Yeah, not really. It doesn't really do jack. It's got fiber. That's it. There's nothing magic about eating oatmeal. And again, anything that you see antioxidant is a common one. Anything that says antioxidant, superfood, magic food, it's not. Sorry. You have to have your whole picture of what you eat has to be well-rounded. Protein recommendations. Again, another question that has come up when I've talked live, so I've added it here. 1.2, maybe 1.5 to 2 grams per kilogram of body weight. So unless you're tying this to resistance training, there's no benefit to just gobbling boatloads of protein. The protein product manufacturers sure like to push protein. There's protein drinks and protein bars. Some of the issues with that is that often they're very high in sugar as well. So be careful of that. I'm a little skeptical of all the push to eat so much protein. So, and again, we have people that eat tons of protein. You know people that eat tons of protein. You might be one of them. You probably also notice that you're not suddenly just bulking up with muscle just by drinking protein shakes, right? It has to be coupled with resistance training. So we don't have a population of people walking around, muscle heads walking around because there's so many protein products. So it doesn't work that way. It's also good to note that there's no evidence that high protein intake damages your kidneys. It's a myth. If you have damaged kidneys already, yes, perhaps that can be an issue for you, but if you have healthy kidneys, you can eat protein. That's not a big deal. So I would say you don't eat high protein because of the effects on insulin, not related to this. But if you're actually trying to bodybuild and you're eating higher protein and you have healthy kidneys, you're fine. There's no issue there. Wrapping up the last couple of things here. So maybe you don't like my low carb, high fat idea. That's fine. Doesn't hurt my feelings. Maybe you want to try paleo, vegan, vegetarian. I'm sure there's in the crowd, there's people that are eating that way. So the themes that people have, whether you're eating keto, low carb, high fat, vegetarian, vegan, all of the folks that I read would agree on this. It's real food. Okay, this is food recognizable by your grandparents and great grandparents. I have a friend who coaches high school athletes and teaches biochemistry. He tells the athletes very simply, if you can kill it or grow it, you can eat it. Okay, so if you can grow it in your garden, if it had a face, obviously animals, ducks, eggs, chickens, whatever, you can eat it, right? So it's real food. It's not processed food. That's throughout, no matter what sort of what flavor of that you want to eat. It's real food. Going forward, some things to think about as you leave here. Okay, one, I hope you'd be interested in some of this stuff. Count your carbs and see where you're at, particularly if you're not happy with how things are going. You have diabetes, prediabetes, hypertension, obesity. You're not liking some of those things. See what your carbs are doing. There's a good chance your carbs are going to be higher than you can tolerate. And certainly if you've already been diagnosed with those diseases, no matter what your carbs are, they're higher than you can personally tolerate. So even if they don't fall out on Mark's Daily Apple on that graph as being really high, maybe only 175 and you still have diabetes, you've proven that 175 is too high for you. So take that in context of the issues that you're dealing with. Another big one would be focus on avoiding processed food. And Robert Lustig, the guy they mentioned that talks about fructose, he actually wishes that diabetes would be called processed food disease. It would change the nature of how we think about diabetes. Like processed food, again, is mainly carbs. It's a lot harder to package protein and fat. Processed food is primarily carbs. Carbs and vegetable oils, they're cheap, they're easily packaged, easily shelf stable. So the less processed food you eat, the better. Try to get some buy-in from your spouse or your family. Making a big switch like this can be pretty tough. Some people need to do clean out the pantry and everything goes to the food shelf. Other people need to just say, okay, like for breakfast tomorrow morning, we're going to have cereal, but we're not going to drink orange juice. We're going to have water because that juice is just mainlining sugar. It has the same amount of sugar as soda does. So let's get rid of the orange juice with breakfast. And try it for a couple of months. You don't have a whole lot to lose. I can guarantee you that you're not going to suddenly have, everybody's at risk for heart attack, right? There's no guarantees in medicine, so I shouldn't even talk about guarantees, but you're really not out much if you try this for a couple of months to see how you feel. See if you're losing weight, see if your duty belt fits better, see if you're sleeping better, see how you feel, your mental energy. And again, I mentioned weight. That's not even the most important thing. I would use all those other markers. Your mental performance, all those other things are better markers than your weight. As a department, and this speaks to command staff that are hearing this, you got to make wellness a priority, which we're already doing by having this as part of your annual training. But engaging spouses is a good idea. Indoctrinating new hires, which has been helpful as I'm speaking to the cadet classes regularly. I come from Plymouth where they had wellness things going on long before I got there. My chief there is well ahead of the curve as far as wellness things go, but they actually have wellness officers, and their job is to keep wellness in the forefront of everybody's mind. Just like they have DT officers and range officers, they have wellness officers. So in terms of your individual precincts out there, get rid of the soda, the juice, the candy, the donuts. You have to change the environment to change people's behavior. So get rid of those as options. Just get them out of there as much as you can. Some summary things. Too much insulin is the root cause of metabolic disease, including heart attacks. So the goal is to keep insulin low, which means eat more fat, eat less sugar and starch. Remember the 80-20 rules. So 80% of your body composition is based on what you eat. Again, give or take a little bit. And eat good 80% of the time. So allow yourself 20% to relax. And again, you can tweak that one if you want to be 90-10. If you really want to dial things in for a bit and see how you feel, make it 90-10. Be a little more strict about it. So, and the intermittent fasting is actually safe and it's doable, more so than you would realize. It's not as crazy as it sounds. Lastly, just a couple comments on a lipid panel. And I debated putting this in here because there's disagreement about the science behind this. This is way oversimplified, but I'll throw out some caveats along the way. But this is a typical lipid panel. You're going to get these numbers. Again, some of you can pull this up on your phone right now and look at your chart. So we'll talk about the pieces of this. We talk about good and bad cholesterol. The asterisk there is because cholesterol is cholesterol. The HDL and the LDL are actually lipoprotein, so it's high-density lipoprotein, low-density lipoprotein. They're not even cholesterol. They carry cholesterol in the blood. So again, right off the face of it, off the bat, this doesn't make sense. It's been way oversimplified for us over the years. There's way more that we know about this than what's here. But the gist of it is that HDL is still sort of thought to be good cholesterol. There are subtypes of that, but the take-home point here is that increases with saturated fat, and that's a good thing. So it's not a bad thing to have high HDL. LDL is one that we chase. We chase it with statins, the Lipitor, the Crestors. Lipitor is the most successful drug of all time. Little side note, that National Cholesterol Education Panel, the people that tell you to eat to drive your LDL cholesterol down, most of those people, the experts on that panel, are also paid by the pharmaceutical industry. So it's no coincidence that they say everybody should have lower LDL when they're the people that benefit from the drug manufacturer selling more drugs that lowers your LDL. So statins will lower your LDL, I guarantee it. That is true. Whether it's good for you or not is a completely different question. So that aside, the LDL is generally referred to as bad cholesterol. There are subtypes of LDL cholesterol though. So some are actually a large, fluffy or buoyant particle. Those are thought to be cardioprotective. There's also small, dense, pro-inflammatory particles, which are thought to be the dangerous ones. So the other part of your panel will include triglycerides. That goes up with eating more carbs. So keep those in mind. Again, LDL, the good stuff, goes up with fat. Triglycerides goes up with carbs. The most useful predictor of heart attacks on your lipid panel is actually the triglyceride to HDL ratio. And this fits with what we know about metabolic syndrome. Because again, the pieces of metabolic syndrome include high blood sugar, high blood pressure, abdominal obesity, high triglycerides, and low HDL. So if that ratio is high, greater than like 3-to-1 or 2-to-1, some people say, again, your triglyceride to HDL ratio, not your total cholesterol to your HDL ratio, your triglyceride to HDL ratio, the lower the better. From what we understand, and again, this is already some outdated stuff because people are way more into the weeds than when I put these slides together, your high triglycerides and your dangerous LDL particles run together. So that's, if you're going to look at something on your panel, look at your triglyceride to HDL ratio. It's sort of a poor man's version of looking at your LDL subtypes, so if you don't have that. As another confounder, by the way, I'll just worth mentioning, your LDL is actually calculated. There's an equation that actually used to calculate your LDL cholesterol, and it gets thrown in the wrong direction, so it can be underestimated or overestimated depending on what your triglycerides are doing. So we don't even actually measure that one directly. So again, more issues with your standard panel that are not particularly helpful. But if you are looking at it for advice, make sure you want lower triglycerides and higher HDL. When you do go to your annual physical, these are some things that are worth discussing with your doc. So especially if you already have some of these issues, if you've been told you have metabolic syndrome, you have high blood pressure, some of these things going on, talk about lipid particle subtyping. It can be done. It's a send-out test, but it can be done. You can also look at fasting insulin and fasting glucose. High sensitivity CRP is a marker of inflammation. Hemoglobin A1C, it looks at your average blood glucose over the last 3 months. So those are other things, but there's better tests out there to look at and see where you are if you're at risk of insulin resistance well before you have diabetes. You could catch some of these things ahead of that. Other things to consider are just a standard EKG, so you have a baseline. The CT cardiac calcium score. Insurance will probably pay some of that. When I had mine done, I think insurance paid some. I had to pay some. Another one worth mentioning is if you're really into the weeds and you're metabolically sick and have lots of these issues already going on, the visceral fat scan is an MRI. It's not paid for by insurance. It's sort of not on the radar of anybody in terms of insurance in the insurance world. But I can also tell you that Richfield Fire did a thing with the MRI folks that are in town and looked at this a few years ago now. There was actually a news story on it locally. They put all their folks on low carb, high fat some years ago, had drastic reductions in their visceral fat, Great weight loss. One of their officers lost 60 pounds. That wasn't not just in 3 months, but over the course of a number of months, lost 60 pounds, which was the weight of his gear, essentially. So you can see some great changes in your visceral fat in just a few short months. So again, if you're way in the weeds, sick with some of these things, that's worth checking out. Last couple of slides here. And again, this is a resource page. I'll make sure you have access to this. DietDoctor.com is the best website that I recommend to patients for low carb stuff. Tons of recommendations about eating. If you really want to get into the weeds and you're one of those people who you want menus, like you want to know, what do I buy at the grocery store? What am I going to cook? I believe it's behind their member page, which again was $9 a month last time I checked. But you can actually put in a meal plan. And I believe it actually, I haven't done this, but I believe it actually spits out your shopping list. So if you're one of those type A's that need to be that organized, check out DietDoctor.com. I would say if you can use that and that helps you, for $9 a month, that's pretty cheap to get all your stuff dialed in that close, if that's something that helps you. If the other big help there, they also just have a bunch of graphs that look at your carb content of common foods. So your above ground vegetables, below ground vegetables, fruits, berries, nuts. As an example, macadamia nuts are almost pure fat. Cashews, on the other hand, are actually really high in carbs, relatively speaking. They're still going to be better than obviously Twinkies, but macadamias and cashews are not the same thing in terms of your total carb intake. So, and it doesn't mean you have to never have cashews, but again, when you're planning what you're eating, looking at some of that sort of gives you an idea like, okay, well, I'm going to aim for more of this stuff on the lower carb side of things. It sort of sets up, makes the low carb, high fat, again, a theme. It's just ideas to help you when you're eating. If you know somebody with diabetes, check out Virta Health. Absolutely a game changer in getting patients off their diabetic medications. And this includes people who have had diabetes for 30 years or on really, really high doses of insulin. Virta Health has success getting those people off. I think they've actually added now a guarantee that if they don't get people off their diabetes medications and reverse their diabetes in a year, they don't get paid, which that speaks to a whole different issue regarding healthcare. And that's a game changer in terms of the healthcare word, because that's not how big medicine works for payment, but that one's a game changer. So again, some other great books. I've mentioned most of these authors. Just scanning the list here, it looks like I think I mentioned pretty much everybody on there at some point. So other good resources to check out. So with that, I will close. Thank you for your time. Hope to see you around, and hopefully not too much in the ER though.